let's talk about something nobody likes to talk about, but we should: aging. All right, so I have patients that come in all the time and they're all trying to slow down the aging process. It's not an easy answer, and a lot of people are surprised that I don't just have one miraculous treatment that will solve all of their problems. So let's start at the base layer, our skeletal layer, our skeleton. So our orbital eye sockets, they widen. Our maxillary bone, like right here, it recesses. Our nasal cavity, it gets larger. So our noses can sometimes look bigger as we get older because things go back this way, but our noses kind of stay forward like that. And then we lose bone mass in our jawline. The bone kind of regresses up this way, and we lose that youthful angle that we all like. So let's go to the next layer, our deep fat pads. So especially in our deep medial cheek fat pads, they shrink, we lose them. This is why we can see flattening in the cheek here, worsening in the tear trough, because that deep medial cheek fat pad, it helps support all the ligaments and everything within the tear trough. So our bone shrinking, we're losing that deep fat pad support, and these ligaments start to droop. We can also see herniation in our fat pads that our eyeballs rest on. That could start to herniate out, and you could start to get the under eye bags. Now our muscles, yes, they elongate, they get thinner, they get weaker as we get older. So then we have the muscular layer, but then we have the superficial fat pads. The superficial fat pads can shrink as well, but some can get larger, especially in the jowls, and they tend to drift down. So these tend to fall, they can get larger or they can shrink, just depending on the individual and their genetics. Now let's move to the superficial layer, the one that we're always staring at in the mirror. And this is our dermis, or our skin. Our skin experiences laxity. Things tend to fall. It also starts to thin. This is a good point, and I bring it up often to my patients with our skin thinning, and this is why neuromodulators can help. So neuromodulators, Botox, Dysport, things like that, all they are doing is simply paralyzing our muscles. They're not creating volume. It's not creating collagen. They're not biostimulators. It's a toxin that paralyzes our muscle. So why do we need it as we get older? It's not that our muscles are getting stronger. To the contrary, as I showed you, they can get thinner and weaker. But it's because our dermis and our skin loses elasticity and gets thinner. So when our muscles are contracting, our skin folds easier because it has lost collagen and elasticity to bounce back. So neuromodulators, we don't get them because our muscles are stronger as we get older. We get them because our skin gets weaker. So when it comes to adding true structure into our skeletal framing, such as our jawline, our cheekbones, our temples, I'm usually leaning towards a thicker G' filler or a higher G' filler, thicker filler, to really give that lifting capacity, just as what our bone would do. So I really love things like Radius for that, Restylane Lift, Juvederm Volux or Voluma are also good options to really provide that deeper down structure. Now, when we're talking about fat pad loss, such as in our deep medial cheeks, mid-face, yes, we lose fat pads in the temples as well, then I like to use softer fillers or biostimulators like Renuva. Now, Renuva is an alternative for fat grafting. It helps us grow our own fat. Renuva does come from human liposuction donor patients, from their fat. It comes from a very trusted and reputable human tissue processing manufacturer, MTF Biologics. They've been in the human tissue processing industry for years. And if you have questions on that, you can reach out. But I love Renuva to help replace the soft tissue loss that we experience in our mid-face, such as our deep fat pads. It does a beautiful job of doing so. I like to replace with whatever we're losing. If we're losing fat, I want to do something that helps promote the fat growth or gain. And then when it comes to our skin, I'm really going to try to tighten and brighten your skin as much as I can. I'm usually doing that through devices, whether it's RF microneedling, our monopolar RF device, which is Everaz, or even our resurfacing or fractional lasers, such as our ultra clear laser. I'm trying to brighten and tighten your skin as much as possible before I'm filling a lot of the times, because that gives natural results. You can't just solely rely on filler to rejuvenate you. If you have a lot of fine lines and wrinkles and sunspots on your skin, or you have a lot of laxity within your skin, you have to try to tighten that up and erase those wrinkles first. Add thickness back into the skin, add elasticity and collagen back into the skin. And then if you tighten and brighten that, you'll need, a lot of the times, need less volume filling. It's like you're shrink wrapping, right? So you're not going to need as much volume because you shrunk wrap things. So I like to address the age-related changes in the skin. I'm usually doing that with a device that we have here in the office. Microneedling's also good at helping maintain your dermal quality and helping with fine texture and lines and things like that. So microneedling's great for maintenance treatments, and many of the lasers and devices are as well. So if you have any questions on the aging process, if you're wondering what treatments might be best for you based on where you're at in the aging process, feel free to schedule a consultation in our office. I'd be happy to see you.